Welcome back. With the Medicare annual enrollment period nearly underway, it's an important time of year for millions of older Americans. Joining us now to discuss, the Vice President of Medicare Advantage at United Healthcare, Betsy Chin. This segment sponsored by United Healthcare. Hey, Betsy, thanks for joining us.
Thanks for having me.
Betsy, let's kick it off with, why is annual enrollment, why is this period such an important time?
Well, the annual enrollment period, which begins October 15th and runs through December 7th, is critical because for most people who have Medicare coverage, it's their one chance each year to make a change for next year's coverage. Now, for many people, if you're on a plan that you love, you can do nothing and the coverage will roll over to next year. But we really recommend that people use this time period, again, October 15th through December 7th, to take a look at their plan, if there's going to be any changes for next year, and then what other options might be available to them to make sure that they're in the best fit for their health and wellness goals next year.
Sure. You mentioned, sometimes you can just do nothing if you just want your, coverage to kind of roll over. But what are some of those important things that we do need to consider when enrolling in a plan?
Yes, absolutely. There's lots of things to consider. We always suggest starting with cost. So make sure that you understand what your plan will cost you, both in terms of a premium, if there is one, as well as things like co-pays and co-insurance on both doctor's visits and prescription drugs. Next, make sure to look at coverage. Are the doctors and hospitals that you want to use covered in your plan's network? And then prescription drugs. Make sure that the medications that you need are part of the formulary or the plan's approved drug list. And finally, take a look at extras. Many plans, including many Medicare Advantage plans, now include extra benefits at no cost. Things like fitness memberships, dental, vision, and hearing coverage, even credits for over-the-counter pharmacy items that many people use, things like vitamins and Band-Aids. So there's lots of things to consider, but starting with cost, coverage, making sure your prescription drugs are covered on the formulary or approved drug list, and then taking a look at those extras are the best places to start.
Yeah, I'm glad you just mentioned that, especially about the medications. What are some things that we should be looking for to make sure that the medications that we're taking, that those are covered in our plans?
The formulary or the approved drug list is the best place to start. You want to make sure that the medications that you know you'll need to take next year are covered on that approved drug list. The other thing to pay attention to is which tier do your drugs fall on. So the approved drug list is often broken into tiers 1, 2, 3, 4, and each of those comes with different cost implications. So you'll want to make sure that first it's on the list, and second, that you know which tier is it on, so you have an understanding of what the costs you may pay next year will look like.
Yeah, so important. Maybe you could discuss for us the different types of Medicare available.
Absolutely. There's a lot of choices out there. Let me start with Original Medicare, which is Parts A and B and comes directly from the federal government. Part A is your hospital coverage. Part B covers outpatient services, things like routine doctor's appointments. Then there's Medicare Advantage, or Part C. Medicare Advantage plans are offered by private insurance companies like United Healthcare, and they combine A and B into a single plan, which often also includes Part D, prescription drug coverage, and many of the extra benefits that I mentioned just a couple of minutes ago, things like fitness memberships, dental, vision, and hearing coverage, OTC credits, etc. All of those options are available to you, as well as Medicare supplement plans. Medicare supplement plans work alongside Original Medicare and pay for things that Original Medicare doesn't cover. Many people choose to pair a Medicare supplement plan with a standalone Part D prescription drug plan to make sure that they've got complete coverage for both health and prescription drugs.
Sure.
Yeah.
So there's a lot of choice out there. And one resource that we recommend taking a look at to make sure you can understand all these options is MedicareEducation.com.
Okay, great. Betsy, thank you so much for taking the time to fill us in today. We appreciate you and your time and all of this information you've given us and our viewers today. Thanks a lot.
Thank you.
Thanks,
Absolutely.
Betsy.
Yeah.